Good afternoon.
Good afternoon.
So, can you confirm your candidate number?
Yes, ma'am. My candidate number is CN246527.
Okay, so your name is Anya Sebastian.
Yes, ma'am.
Shall we move on to the warm-up session?
Yes.
Do you consider yourself as an ideal nurse?
Yes, of course. I think that I am an ideal nurse. I believe that a nurse should possess some qualities like communication skill and punctuality. And I think that I have all those qualities like an ideal nurse. And I believe that I am an ideal nurse.
Do you think gender disparity is prevailing in your profession?
No, I don't think there is any gender disparity in my profession. Yes, of course, it was a female-oriented profession in the olden days, but nowadays both female and male nurses are getting equal opportunities. And as of course, there are some gender preferences, like more male nurses are preferred to be work in the emergency department. Likewise, more female nurses are coming to the gynec departments. Yes, there are some gender preferences, but there is no gender disparity.
Which will be your preferred department to work in?
I really like to work in the emergency department because I think there are more cases are coming in the emergency department. So I can really improve my knowledge there, and I can use my critical thinking skills there. And I think that I can understand many cases, and also I can use many kind of equipments. Likewise, I can improve my knowledge and also efficiency in my profession. So I really like to work in the emergency.
Okay, so that is the end of our warm-up session. Now we move on to the role play. Here, you will be given 3-minute time along with your role play card in order for you to prepare. And after that, you are supposed to enact the role play in the following 5 minutes. Okay, so here is your cue card, and you will be given 3 minutes time for preparation, and your time starts now.
Good morning.
Good morning.
I am Anna, one of the registered nurses working in this clinic. So, if I am not wrong, you are Thomas and you are here for the cyst removal. Am I right?
Yes, nurse.
Okay. But Thomas, you look so stressed. May I know what is the reason?
Yes, nurse. Actually, the doctor told me that I have something called squamous cell carcinoma. And I think it is just another name for a skin cancer. So, that's making me really worried.
Well, Thomas, standing upon your shoes, I can really understand that you are really worried. But I want to say that, as you said, squamous cell carcinoma is another name for skin cancer. But there are many treatment options are available, like surgery. And in your case, the surgery is already done, and the lesions are already removed, and this cancer is unlikely to spread. Are you getting my point?
Yes, nurse.
Okay, but I really want to say that it is very important to look after yourself. Like, it is very important to monitor your skin, like for any changes or any spots, and try to do a regular checkup with your GP. Is that okay for you?
Yes, nurse.
Okay, but still, I think that you have something to ask me. I know what it is.
Yes, nurse. Actually, I have a better understanding of what squamous cell carcinoma is now. And I would like to know, is it likely to need more surgery to remove the lesions in the future?
Okay, Thomas, I know that you are going through very stressful situation. And in this situation, it is really common to ask this type of questions. But I am really sorry that it is beyond my scope to answer these questions. Because the surgery is done by the doctor and the decisions are taken by the doctor only. If you want that, I will make an appointment with the doctor, so you can directly talk to him regarding the surgery options. Is that okay?
Yes, nurse.
Well, Thomas, if you don't mind, may I ask you some questions?
Yes, nurse.
Okay. Are you using any kind of sunscreen or hats whenever you go out in the sun?
Yes, nurse. I always wear a factor 30 sunscreen or higher, and I wear a hat whenever I am out in the sun. But I think it's too late. It's of no use because the disease has already set in my body.
Okay. Try not to worry, Thomas. First of all, I really want to appreciate you that you are following all the suggestions by the doctor. And Thomas, some damages are historical. We can't change it. But we can do something that it will not come in the future. So try to continue all the things that you are doing now, and try to cover up whenever you are going out in the sun. I really like to suggest to continue covering up in the sun to prevent any future damages. Are you willing to do so?
Yes, nurse.
Well, Thomas, do you notice any kind of pain or discharge after the surgery?
Actually, nurse, the wound has been fine and there is no pain or discharge. But I still think that it is too early to have the stitches out.
Okay, I can really understand that your question is really valuable. In this condition, it is very important to remove the stitches. As you know that your doctor is already checked your wounds, and also the wound healing is in a good progress. So it is very important to remove the stitches after 7 to 14 days. Is that okay?
Yes,
Thomas, do you know about the aftercare?
actually, no.
Okay, don't worry, I will explain you regarding that. After the stitch removal, try to keep your wound clean, covered, and dry. Are you able to follow that?
Yes, nurse.
Okay. So, do you have any other concerns?
No, nurse.
Okay, so I think Thomas, I have cleared all doubts. Okay, Thomas, if you found any problems, please try to contact the doctor immediately. Is that okay?
Yes, nurse.
Okay, do you have any more concerns?
No, nurse.
Okay, I think I have cleared all your doubts. And I want to say, if you are following all my suggestions, you can definitely get back on your feet. So try to do so. And if you have any queries, please contact me. And for now, are you willing to do the stitch removal?
Yes, nurse. However, I have to do that.
Okay, please give me the consent get signed.
Okay, nurse.
Thank you.
Thank you.